On average, girth makes a difference. And so when we talk about with this, because it's kind of hard to visualize, this is a safe for daytime TV way to show you that when you start here, you can see the circle is kind of the circumference or the girth we're talking about. You can move up to something like this. So it's not a huge amount. These are fat cells and stem cells, which you're harvesting from the person and then injecting back into their own tissue.
And typically we take the fat from wherever they have fat, usually in the abdomen, wherever we can find it. The key is purifying this fat. We inject the fat at the base of the shaft of the penis with blunt cannulas, needles, so that we're not going to hit, obviously, key structures and injure them.
Is there a risk of a lumpy penis?
Well, that was the deal back in the day when fat transfer was not as refined as it is today. I saw some weird-looking penises.
Wait,
right? I mean, I saw cauliflowers,
like the very
basically every vegetable that
So these men were really taking a huge risk just to get a few inches of length. Well,
yes, and when you had that uneven, the fat would take in one part of the penis and not in the other.
Right.
Those were.
But the reason this is important to discuss is there are men out there with a micropenis.
Yeah.
And that is a known thing. And so if this procedure allows you to avoid that lumpy, bumpy cauliflower injection result, I think it's important to acknowledge that there are some men out there where this could be a real lifesaver.
Scenario, yes. I think, in fact, that combination treatment that I described for somebody like that.
Lengthening and width.
Yeah, that could
So
be.
have you used this on people?
I have, yes.
And did they like the result?
Yeah, they have. They have. Today, with the way we can control it, you have to be very careful and very deliberate the way you put that fat in nice, even rows, because you don't want lumpiness.
But I think we also have to talk about the psychology of this. So, it's really interesting. Dr. Travis, you brought up a micropenis. That is a penis that is erect. We're talking about 1 inch or 2 inches. A lot of men actually think they have a small penis, but it's actually well within the norms of average. So, we know the average size of an erect penis is somewhere between 5.1 and 5.6 inches. So a lot of these men having these procedures, they're normal, and if they have any type of body dysmorphic disorder,
I worry about this for that reason alone, which is if we get to a point where this is used for men other than those, for instance, with micropenis that truly could benefit, and you're starting to see every second or third guy going in for these, all of a sudden you get to a point where it's men trying to keep up with one another, and I could see some untoward outcomes.
Well,
so I think you do have to.
I think it's important to point out that a different study showed that 85% of women are satisfied
so
with their partner's penis.
And
that's really important, because even though, like you said, many of the men who perceive themselves to be smaller actually average their 5.5 inches, everything good, it may be more of a psychological overlay there.
You sure don't want to be that 15%, though.